All right, class, I am going to do the chapter 10 on the skeletal muscles. Okay, so we're doing chapter 10 on skeletal muscles, types of muscles, cardiac muscles. So we're going to go over here. Cardiac muscles are found only in the heart. Cardiac muscles consist of short, branching fibers that fit together at intercalated discs. We did talk about intercalated discs before. Now, we don't need to focus on cardiac muscle tissue for this section, but I just want to remind you that there's different types of muscle tissue. Smooth muscle tissue, that's found in the digestive system, blood vessels, bladder, your airway. Okay. Both of your cardiac and your smooth muscle are involuntary. Your skeletal muscles are voluntary. So your skeletal muscle is attached to bone and it causes movement of the body. It appears striated when you look under a microscope, or like it has stripes in it. For muscle function, you have what's called an origin and an insertion. Each end of the muscle skeleton adheres to a part of the bone. The contraction of the muscle causes one bone to move, whereas the other remains relatively still. So this whole little section gives you good information. It says the end of the muscle that attaches to the more stationary bone is the origin. Okay, so you can see up here, this is the more stationary bone, this part of the humerus. The humerus is a long bone in the upper arm. So that's the origin. The more mobile bone attaches to the insertion. Okay, so this is the insertion here. They're showing the radius, which is one of the bones in the forearm. The main muscle triggering the movement is the prime mover. Okay, so for example, this would be the bicep. And that's what you need to know for this. So you need to know your origin and your insertion. We talked in class about the belly of the muscle, which is the center part of the muscle. But you definitely are going to need to know the terms origin and insertion.
I have many students ask me, what is the difference between origin and insertion? And this is all about learning a new language. So when we think about the new language, we really have to understand what it's about. So let's step back and think origin and insertion is all about muscles. What's the purpose of a muscle? The purpose of a muscle is to move a joint. So when we look at a muscle, it has to cross over a joint and it's going to attach to two different bones. Let's use brachialis as an example. Brachialis attaches on the distal 1/3 of the humerus and it comes down onto the ulna. Its main job is for elbow flexion. So when we think about its movement, the humerus must be stable and the movement is at the ulna. So on the ulnar aspect, that's where the insertion is, and the origin is going to be on the humerus. Origin is the stable part. Insertion is the attachment that has the moving bone.
The next part we're going to talk about is the muscles of the trunk. You have the external intercostals and the internal intercostals. These are responsible for muscles that are responsible for breathing, assisting with breathing, as well as the diaphragm. The external intercostals, they lie superficially between the ribs, and they elevate the ribs during inspiration. The internal intercostals, they lie deep under the external intercostals. Then they depress or push in the ribs to force exhalation. The diaphragm enlarges the thorax to trigger inspiration.
During breathing, the intercostal muscles contract, pulling the rib cage upward while the diaphragm moves downward, drawing air into the lungs. A restricted airway reduces pressure in the chest cavity, creating an inward movement between the ribs called intercostal retraction, particularly visible in children. In cases of severe respiratory distress, the sternum will visibly retract as well.
Okay, muscles of the shoulder and the upper arm. It's on page 168. The one we discussed is the deltoid muscle. Okay, that is the muscle of the upper arm, and this is a common muscle for a intramuscular injection, generally a small volume of fluid. Then you have muscles of the thigh. That's on page 169. You have the sartorius muscle, which is this, it's the longest muscle in the body. And then you have the muscles on your quadriceps. You have the rectus femoris. Okay, if you think of the femur, you can remember that one. The vastus lateralis, which is on the outer side, the lateral side of the thigh, and the vastus medius. Okay, that's towards the medial part of the thigh. Muscles of the hip and thigh. You have the gluteus medius, the gluteus maximus. So this is smaller, this is larger, it's maximus. The gluteus maximus is the bulkiest muscle in the body.
So, for starters, IM injections are when a drug is given through the muscle for absorption by the body. This is considered a parenteral route, which means it doesn't go through the GI tract. Now, drugs given intramuscularly generally take longer to be absorbed by the body than some of the other parenteral routes. It depends on the medication and the type, but IM injections usually take somewhere between 15 to 30 minutes for full effect. Now, there are three major areas that we give an IM injection. These are the deltoid, we have the vastus lateralis, and the dorsogluteal muscles. Depending on the size of the muscle mass and the area that we're going to give it, you can give anywhere between 1 and 5 cc's of medication. So now that we've told you what it's about and kind of what it entails, let's get into how to give an intramuscular injection.
That was just a little brief overview about injections. You don't need to know that for the test though. And that's just a summary of what we discussed in chapter 10 on the muscles.